Joining us now is the Head of External Affairs at the Adam Smith Institute, Morgan Schondelmeier. Morgan, you've been examining the data very closely, as have your colleagues at the Adam Smith Institute. Are you concerned that these case numbers may be used to scare us into another lockdown, or do you think we should be concerned? Do you think another lockdown should be under consideration?
Right, thank you for having me. So we did a paper, as you say, we did a paper on this published in mid-September called Life with COVID. So talking about how we now need to live with this virus, what we can do to minimize risk, and how we avoid another lockdown. So just as the professors were saying, vaccines are a huge important part of this. We need to make sure we're encouraging everyone who's yet to be vaccinated, especially the vulnerable population, to make sure that they go out and get their jab, because there is evidence that the link between infection and death is broken, or at least vastly reduced by the vaccine. So if we're encouraging people to get the vaccine, we are seeing rises in cases, which, as the professors said, aren't translating into deaths or hospitalizations at this point. And that's a very important distinction to be made. So before, case numbers were the end-all be-all. As cases were going up, we needed to lock down. But the important thing is now that's been curtailed. So we can kind of more focus on things like deaths and hospitalization rates as a more accurate indicator of how serious the pandemic is at any given point.
Morgan, the logic of lockdown in the past has been, stay at home, protect the NHS, save lives, to avoid the horrific possibility of the NHS being completely overwhelmed. But at the peak, we were looking at 7,000 hospitalisations a day related to COVID. We're now looking at just a few hundred, and the net number, when you include hospital exits, is even lower than that. There seems to be a consensus among the distinguished scientists that we've spoken to over the last hour or so that there won't be renewed lockdown. Is that your political and data reading too?
As I say, the link has been broken between cases and hospitalizations and deaths. So if we're focusing on the hospitalization and death rates, there doesn't seem to be much justification for a lockdown. The trouble is, once the government made the political decision and the health decision in the first instance to go into lockdown one, once that precedent has been set, there's a lot of social and political pressure to follow up with that decision over and over and over again. And that is kind of how we saw ourselves in lockdown 2 and 3. The science was very different at that point. So lockdowns did help with reducing transmission, helped with reducing death rates in a lot of ways. But as I say, the science has now changed because we have the vaccine. So the actual incidence of people who are becoming seriously ill is much decreased. So we need to make sure we're focusing again on the actual data, which is more important now, which would be hospitalizations and deaths. So as of yet, I don't see any justification for going into another lockdown. I know there will be calls to, again, reduce pressure on the NHS. But the problem is the NHS is under pressure every winter. We get the winter crisis splashing on the headlines every single year, and that's not going to change this year. But with the added pressure of COVID, we could see some additional stress on the NHS, in addition to the waiting list, in addition to all of these things that have been building up over the last 18 months.
But you're a savvy political analyst, Morgan. There will be enormous pressure on the government. There'll be very vociferous lobbies pushing for lockdown, potentially some public sector unions pushing for lockdown. It is going to take a certain amount of determined resistance by the Prime Minister, isn't it, to wield the data that suggests lockdown isn't warranted, if indeed that is the data, and to resist those pressures.
Yeah, I think you're right. As I say, the precedent was set in March 2020 that we would do anything necessary to save lives. And whether or not you agree with that decision, that having been done is now kind of the benchmark for what we're willing to do. We need to make sure that we are following the science. I know this is a statement is a bit controversial, but if the SAGE and the Prime Minister look at this data and see that there actually isn't that much of a translation between cases to people entering hospitals, we need to be much more level-headed about where this pandemic has really left us in 2021, far along from when we started, and making sure that we are taking into account the harms of lockdown and really actually balancing this with the case as it is now, not how we would have interpreted it in 2020.
Morgan Schondelmeier of the Adam Smith Institute, thanks for your contribution. Level-headed, I think, there being the operative phrase. You've been contacting us